Welcome to Module 2, Adolescent Development and Transition. This is the second of 10 modules in the course Healthcare Transition Training for Educators. This module provides information on adolescent development from the third edition of Bright Futures and evidence-based models of condition management. This module outlines healthcare transition stages that occur during adolescence and discusses uses of the gradual release of responsibility framework. By the end of this module, you will be able to describe adolescent development stages, define healthcare transition stages, and identify youth with special healthcare needs and their developmental tasks. Healthcare transition is part of a developmental process. Independence in areas of life such as school, work, home, and recreation are important for developing skills that make healthcare transition easier. Consider the transitions that students prepare for: middle school to high school, graduation to post-secondary education, and school to work. The healthcare transition takes place within the context of these life transitions. Transition is an individualized process. Some of these suggestions will be better suited to younger or older children, and not all strategies will be appropriate for everyone. Include these suggestions where appropriate in your transition services. You may already be familiar with the key adolescent developmental tasks. In the next few slides, we will review early, middle, and late adolescence. All students at this age are self-conscious of and anxious about their appearance and body shape. With the move to middle school, old friendships often end. Making new friendships can be difficult for teens who are different from the so-called typical. This can be a very difficult time for adolescents with chronic health conditions. Key developmental tasks of middle adolescence are to become more independent and autonomous, to rely on one's own judgment, and to forge independent relationships. It is typical for youth in middle adolescence to feel that their parents cannot really understand them, and to begin relying on friends for support and advice. This is also the time when many youth engage in risky behaviors and try new things. Adolescents with typical cognitive development are becoming more capable of complex problem solving and decision making. This is an emerging skill. Youth need the opportunity to practice and learn how to consider multiple elements simultaneously, systematically, and exhaustively. Late adolescence marks many transitions to adulthood. By the end of this stage, the student attains all legal rights of adulthood. However, brain development continues until around age 25. Successful healthcare transition is a long-term developmental process that is comprised of 3 stages: envisioning a future, age of responsibility, and age of transition. The age of transition is divided into 2 phases, early and late. The age ranges for the stages serve as a point of reference and will vary based on the abilities of each individual student. Envisioning a future is a critical first step in the long-term process of healthcare transition. This stage starts at the time of diagnosis and continues throughout early adolescence. Envisioning a future recognizes that the child will become an adult and the importance of healthcare transition preparation. During the age of responsibility, a child should receive steadily increasing levels of obligations for their own healthcare management, medical decisions, and household tasks. During the age of transition's early phase, the adolescent and family gather information, start setting specific goals, and develop a written plan for achieving them. The young person assumes a more independent role in working with healthcare professionals and making medical decisions. Caregivers support the youth's increasing autonomy. The late stage of healthcare transition begins when the adolescent turns 18 and gains new legal rights and responsibilities related to confidentiality, consent to treatment, and medical decisions. In this phase, the young adult and their family must begin the process of transferring to adult medicine. Health insurance considerations arise throughout this phase. Before we continue with our discussion on adolescent development and transition, this section will spend time defining the phrase youth with special healthcare needs. It provides additional information about who youth with special healthcare needs are and what types of conditions they have. You will also see how youth with special healthcare needs fit into the IDEA eligibility categories for special education and transition services. The healthcare community defines children and youth with special healthcare needs, or YSHCN, as those who have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. Defining youth with special healthcare needs focuses first on the different kinds of care included in the student's treatment plan. After considering the content of the treatment plan, healthcare providers assess the condition's impact on the student, both in the intensity of their care and the way it changes day-to-day life. Finally, medical providers consider the larger state of the student's health. If the patient's treatment plan includes special health care for 1 year or more, then it would be appropriate to identify the patient as youth with special health care needs. This definition excludes students who do not experience a health consequence, such as increased treatments. It also excludes patients who are recovering from a short-term illness or injury. Unlike the healthcare community, educators use categorical areas to identify students who may qualify for special education services. These areas are categorized by the type of health condition or disability. Consider these examples of students with chronic health conditions. Each one meets both the definition of youth with special health care needs and also eligibility criteria for an IHP, 504 plan, or IEP. The U.S. Department of Health and Human Services has a sub-agency to address the needs of children and families, called the Maternal and Child Health Bureau. Every 10 years, this bureau completes a national survey of children with special health care needs. This survey works as a census to determine how many youth with special health care needs live in the U.S. It also identifies common experiences among families with youth with special health care needs. The most recent survey identified nearly 74 million children in the U.S. Nearly 20% were youth with special health care needs. Another way of identifying the prevalence is to ask how many families include youth with special health care needs. The answer is 23%. Youth with special health care needs are prevalent among all income brackets. Notice that they are the most prevalent at the lowest and highest income levels. When you hear the term children with special health care needs, you might think about students who have chronic conditions that require continuous care, like diabetes, have a significant impact on functioning, like cerebral palsy or epilepsy, or are life-altering, like muscular dystrophy and cystic fibrosis. However, these complex conditions are quite rare, even among youth with special health care needs. The national survey data show that most children who meet the youth with special health care needs definition are affected by more common and less severe conditions, like asthma, ADHD, and migraine headaches. Mental illnesses, chronic pain, and developmental delays are also quite common among youth with special health care needs. Specific conditions, which special educators see every day, like autism or seizure disorders, are fairly rare within the larger population of youth with special health care needs. The data also show that 1/4 of youth with special health care needs are affected by 3 or more conditions. It is also noteworthy that over 12% of children are affected by a disorder that was not included on the National Survey's extensive list of conditions. This is because children are affected by more than 600 identified conditions, many of them very rare. Because so many different chronic medical problems and disabilities affect children, it is unreasonable to expect educators to be knowledgeable about all of them. One excellent source of basic information about childhood medical conditions is the Medical Problems section of the Kids Health website, which was developed by the Nemours Foundation. The next section examines specific concerns of youth with special health care needs during adolescent development. Youth with chronic health conditions and disabilities will have a growing knowledge of the limitations that their health problems may have on their futures. Throughout adolescence, there is a greater importance of development for youth with special health care needs. They may face more barriers to fitting in and developing self-efficacy as they realize the effects of their specific chronic condition. Early adolescence is the beginning of the process of letting go. It is critical that parents encourage their child to be more independent. During middle adolescence, many teens also want more privacy. They may put up "please knock" or "do not enter" signs on their bedroom doors as a way of establishing their own boundaries. This is also the time when adolescents establish some emotional distance from their parents and want to spend more time with others their own age and gender. Parents may feel hurt that their child no longer shares everything with them, yet this is a normal and necessary part of adolescent development. These tasks are even more important for youth with special health care needs. It is important to help youth develop self-care skills and decision-making skills before they reach middle adolescence. Issues related to the adolescent's chronic health condition should not be the subject of parent-child power struggles. This section describes practical strategies for addressing healthcare transition that are complementary to adolescent development. As the child becomes a teen, the educator's tasks include supporting the adolescent's autonomy, promoting the teen's self-efficacy, and finally, facilitating the young adult's interdependence with their community. Supporting optimal psychosocial development is a significant part of the educator's role. Good social skills greatly increase the probability that an adolescent will successfully transition to adulthood and compensate for limitations in cognitive and motor development. Children with chronic health conditions who develop and maintain friendships with peers are more likely to become independent and happy adults. By age 18, young people should be able to answer all the doctor's questions, know what questions to ask, and be assertive to get the care they need. The gradual release of responsibility framework naturally parallels the healthcare transition stages. How is healthcare transition similar to other transitions your students prepare for? How does healthcare transition fit in with the IEP and Section 504 goals your students already create? Jot down your responses to these questions. The slide will automatically advance in 1 minute. The medical provider should also work with the student and family to prepare for the transition. Their activities should complement those in the IHP, IEP, or 504 plan. Self-efficacy is defined as the belief in one's own capabilities to organize and execute a course of action that will achieve specific goals. Promoting self-efficacy involves helping adolescents to gain the knowledge and skills they need to be successful, to make good decisions, and to have confidence in themselves. Fishful Thinking is a website sponsored by the National Association of School Psychologists. It includes tip sheets and strategies for building students' sense of self-efficacy. Their tools are useful for many different professions. It is much easier for youth to prepare for healthcare transition gradually than to do so abruptly. This process takes time.
I've always, especially with my current doctor and also Dr. Rosenberg, always treated me as if I was, I was never looked down on. Because I was younger. I was always asked the most serious or direct questions about my health were asked directly to me, and they valued what I had to say about it. They weren't types of doctors that would just send me to lab tests and get some blood and then they'd decide what was wrong with me. I was very involved in the process of my health care, and I was always involved in the decision making based upon what my symptoms were, how my treatments were going to proceed. They always kind of included me in that decision making process. So that I think is very helpful and continues to be. Continues to be nice to know that they're actually listening to what I'm saying, and at times they're letting me control some of the treatments and letting me control how my healthcare is proceeding. That's nice.
Planning for healthcare transition also involves a discussion of other transitions, such as from high school to work or higher education. Talking about these future events illustrates the connection between health and achieving future life goals. Educators play a key role in teaching families and youth what issues need to be addressed, providing healthcare transition-related information, coordinating resources, identifying priorities, and developing a plan to address these priorities. During this early stage, parents should begin to coach their children to answer one or more questions at medical visits so that they are comfortable asking questions about treatments, medications, and the future course of their conditions. In addition, parents should also be encouraged to give their child choices whenever possible. For example, allowing the child to choose what clothes to wear to school provides them practice in making decisions and also gives them a sense of control. Ask families to envision a future for their child. Of course, the future is uncertain and plans may change over the course of a child's development. However, envisioning a future makes it more likely that families and ultimately young adults will begin planning for their vision. It is critical that parents and ultimately students themselves ask these future-oriented questions. While there may not be clear answers to these questions, the process of asking will orient everyone to the future. Once parents have envisioned their child working or living independently, it will be natural for them to provide opportunities that will move them toward these goals. Independence in self-care, including health-promoting activities, is a building block of living independently and being employed. Middle adolescents should have responsibilities such as chores around the house and expectations for the completion of school assignments. At the same time, they need opportunities to develop independence in the areas of finance and interacting with other adults. Involvement in community and activities with friends are also important during this time. During the age of responsibility, the student needs opportunities to take an increasing level of accountability for daily self-care and general health care. This stage is especially challenging for parents or caregivers of children with complex conditions, who have been very involved in the care of their child for many years. Examples of taking responsibility for one's own health care include telling parents when the supply of medications is low so more can be ordered, and calling doctors to make or change an appointment with supervision from parents. During this stage, the caregiver's challenge is to move from the role of doer to that of coach. The Canadian Hospital for Sick Children provides guidance for parents of youth with special health care needs on supporting their child's growing self-efficacy. The Canadian Hospital for Sick Children provides guidance for parents of youth with special health care needs on supporting their child's growing self-efficacy. This resource offers guidance for educators to appropriately discuss sexual health and developmental disabilities with students, parents, and caregivers. Encourage youth and families to think about what skills they will need to be successful in the next phase of life. Can the young adult live independently, begin post-secondary education, maintain employment, and navigate life in the community? Educators play a key role in helping families and youth to understand what issues need to be addressed, providing healthcare transition-related information, identifying resources, and supporting them to determine priorities and develop a plan to address them. In the late phase, the young adult and their family need to begin the process of identifying adult primary and/or specialty care physicians and transferring care. Educators can also help young adults to understand that interdependence is a sign of maturity, that they can and should make good use of all available resources, support, and guidance as they establish a life of their own. Before closing this module, we will review the resources for use in your transition services. The American Academy of Pediatrics website offers many tools for implementing the third edition of Bright Futures. Many of the images and information in this presentation came from the third edition Pocket Guide. These tools use the gradual release framework to create age-appropriate scaffolding for students at each stage of adolescence. All students should be given an increasing level of responsibility for their own health care in keeping with their physical and cognitive limitations and strengths. Use the links from this course's toolkit to access the tools from this module. The relationship between adolescent development and healthcare transition stages plays an important role in the next module, working with the healthcare community. You can pause the presentation for a quick break or continue directly on to the next module.